Hello, good day. This is your RN Buddy Junli Scala, and of course, for today, we will be discussing the concept of asthma. Isa po ito sa pinakamagandang konsepto under sa ating medical surgical nursing, and we will be enjoying the entirety ng ating pong discussion. So before that, let's have first a sort of review. Let's talk about your hypoxic drive. Now, kapag sinabi po nating hypoxic drive, no, the normal hypoxic drive daw ng isang tao is actually carbon dioxide. So anong ibig sabihin nun? No, when we say hypoxic drive, this is the reason why we are breathing, or this is simply the stimulus for breathing ng isang normal na tao. At para daw sa mga normal na tao, ang ating hypoxic drive is carbon dioxide. So anong ibig sabihin nun? This means that the reason why we breathe is because of the presence of carbon dioxide in our body, which we need to excrete. So you heard it very, very right. So ibig sabihin, kailangan natin i-excrete ang carbon dioxide at ito ang dahilan kung bakit merong process of respiration. So kung walang carbon dioxide sa ating katawan, there is therefore no respiration. So ganun lamang po ang ibig sabihin nun. But no, that's not actually the case in our COPD. So ano ba ang COPD na ito? When we say COPD, it is the chronic obstructive pulmonary disease. No, it is a triad of respiratory conditions contributing to cause respiratory system dysfunction. So ibig sabihin, ang COPD pala na ito is actually a collection of three respiratory conditions, no, contributing to cause respiratory system dysfunction. So ano ba ang mga tatlong disease na ito? What are these three diseases? So we have your asthma, you have your emphysema, and of course, we all know this thing, our chronic bronchitis. So tandaan po natin, asthma, emphysema, and then chronic bronchitis. But for this session, we will be talking about the concept of your asthma. When we say asthma, it is a respiratory condition marked by spasms. We have to take note of this because this is PNLE sensitive. It is a respiratory condition marked by spasms in the bronchi of the lungs, causing difficulty in breathing. There is chronic inflammation of bronchi and bronchioles, and of course, excess mucus. We have to take note of the word spasm, no? And also the word inflammation. Because sometimes, you know what, ang ating mga gumagawa ng exams, such as say, for example, in our board of nursing, they don't use the word spasm, they don't use the word inflammation, they sometimes use constriction, no? Yun yung mga specific words that we need to take note about. So again, when we say asthma, this is a respiratory condition marked by spasms in the airways, such as your bronchi, your bronchioles, and of course, the other parts of the airways inside our respiratory system, such as those that are located in the lungs. And also, we need to take note na may excess mucus talaga because there are some who says that wala talagang mucus or walang secretion sa ating asthma. But I want to tell you that there really is. Now, what are the causes of asthma? So remember, when we say causes, because perhaps at the end or at the back of our minds, we are thinking about the allergens, and that's correct. So now, to take note of the causes of our asthma, let's take note of the word asthma itself. So when we say for A, that's allergens. For S, we have three: smoking, sports, and then stress. For your letter T, we have your temperature change. So it means that kapag meron po tayong extreme or sudden change in temperature, so that may trigger asthma. Letter H, we have your hazards, such as those hazardous substances that we can inhale. Okay, also we have your microbes or microorganisms. And of course, letter A, anxiety. Anxiety can actually cause or trigger asthma. So we need to take note of A, allergens, S, smoking, sports, stress, T, temperature change, H, hazards, and microbes, and letter A, anxiety. So what are we going to take note? No, paano natin masasabi that our patient is really experiencing asthma attack, or what are the signs and symptoms of this disease? First is, of course, there is SOB, or the shortness of breath. Of course, that's very, very common. We need to take note of that. Another is the patient is unable to speak. So take note how many words they can say before taking a breath, because there are some who really cannot speak anymore and even cannot a nurse cannot actually assess a breath sound. Also, may cough din tayo, and also increased breathing efforts, wheezing, prolonged expiration, and yun, kasasabi ko lang po, unable to hear breath sounds. So kapag hindi na po natin narinig ang breath sounds ng isang pasyente na known asthmatic, of course, there is now a complete obstruction. It was once asked na kanina there is an absent breath sound. Now ngayon nagkaroon na ng breath sound or nakarinig na tayo ng wheezing. That is actually a sign that there is a progress, no, or there is an improvement on the management that we're doing. Such as say, for example, we are giving bronchodilators. Okay, we have to take note that the signs and symptoms for your asthma: shortness of breath, unable to speak, cough, increased breathing efforts, wheezing. This is very, very classical to your asthma. You remember about this one. Prolonged expiration, unable to hear breath sounds. Okay? Now, how do we manage our asthma? In managing our asthma, of course, we just follow the universal pattern for our safety, which is your ABC, or your airway, breathing, and of course your circulation. Now for your airway, guys, okay, your airway, we want to first ask ourselves if our patient needs intubation. Kailangan bang intubate ang pasyente natin? If not, do we have adrenergic agonists like your albuterol, which opens the airway? Of course, you need to put in your mind that you need first to open the airway before giving your oxygen. Dito mismo nagkakamaling ating mga students in making an answers in the cases of asthma. Kapag pumasok ang isang pasyente sa emergency room, we do not immediately give oxygen. We first secure that there is a patent airway. No? So if the patient is unconscious, do we need to intubate? No. If not, do we have adrenergic agonists like your albuterol, no, which opens the airway, and then that's the time we proceed to your breathing. So we give now oxygen. We also prepare for theophylline as ordered, which is a potent also a bronchodilator. Of course, very, very common na to. This is the ipratropium, which is an anticholinergic. We also give dexamethasone, which is a steroids, and also we provide circulation, no, or through IV fluid. So remember that one. Okay. Again, when managing our patients, we need to take note of a prioritization pattern, which is a very, very good pattern, which is your airway, breathing, and circulation. Now, how about having these very good mnemonics? Asthma also, just like what we have in our causes. So for your letter A, we give adrenergic agonists. For your S, we give steroids. For your T, we give theophylline. For H, of course, we hydrate our patients via fluids. For letter M, mask for oxygen delivery. And letter A, anticholinergics. Remember, when we say hydration, we do not give, okay, hydration through oral routes. Of course, we need to highlight this one, that in hydrating our patients, it should be given intravenously. Remember that one. Okay. Now, for long-term cases, we give inhaled corticosteroids such as your budesonides and palticazone, which should be taken daily. Remember this one. Okay, we also give your eucatrins, also for your long-term cases, such as your montelukast sodium, which blocks leukotrienes from over-responding to triggers. So this is a very, very common also drugs. Now, another also is we give theophylline, which is a potent bronchodilator, and this helps keep bronchioles open and prevent wheezing, but must be used regularly. Remember this one. And of course, there is the very, very classical long-term cases management, control of your allergens, or those extra um, anything that is within the environment of the patients which causes asthma attacks, no, such as cleaning of the environment, minimizing dusts, pet dander, and we also, of course, the avoidance of molds, and then avoidance also of secondhand smoke, which is one of the common causes of allergens, or one of the most common causes of asthma attack. Remember this one. So that ends our discussion for your asthma. I hope and I pray that this helps you in your examinations. So good luck, everyone, and God bless to all those who are going to be taking the May PNLA. Again, this is your RN buddy saying you goodbye.